What's going on, guys? Dr. Natty here from Myokinetix Physical Therapy and Performance, and today we're talking about sciatica pain. That pain that actually radiating from your buttocks all the way down to the back of your knee, or sometimes even all the way down to your foot. So the reason why, you can see this, you have this nerve that's traveling down, coming across all your glutes, all your piriformis. If the muscle is tight around here, it's actually going to compress this nerve. Or if you have bulging disc, the disc itself can also compress the nerve root. So we're going to go over that today. Now, the key to this is you want to make sure when you do this, you actually feel better, right? You don't feel worse. That's the biggest thing. Now, if you were walking in and you have sciatica pain, these are some exercises we'll actually prescribe to you as your doctor of physical therapy. So let's get right into it. All right, guys, before we get started, I just want to throw something out there. So the exercise I'm showing you is really good if you have shooting pain down the legs. And the key to all these exercises is that as you're doing it, the pain should not get worse down the leg. It should actually feel better. If anything, it should radiate up and not down towards the legs. So that's one key matrix to make sure you're doing correctly. Is actually helpful for you. First thing we're gonna do, we're gonna go loosen up those soft tissue muscles that I talked about, especially around your butt, around your piriformis. So you're just gonna get a soft ball or a trigger point ball that we have here. I like this one because it actually vibrates. It's actually losing the muscle a lot quicker. So as I turn this on, it starts vibrating. All you're gonna do, find a flat surface. You can do it on the floor, whatever it is. I'm just gonna do it on this table here. And we're gonna go 30 seconds on this, right? So I put this right here. I wanna focus on where my sit bone is, right? And I'm gonna place this right here. As I'm doing this, you see I'm bending my knee gently. I lock this right here, and I'm gonna slowly lean in till I feel that tension around here, okay? As I feel that tension and I feel like that tenderness, I'm gonna slowly drop this leg down like so, and we're gonna do this 10 to 15 times. So like right there, that's a good spot for me. So we'll do this together. So we wanna loosen up that muscle, right? Because all we're talking about is kind of like a traffic jam. We wanna make sure we clear the road so that way the nerve can travel in a comfortable speed. And if you want more pressure, you can lean in even more. And I like to do this throughout the day, especially if you're dealing with this pain right now and it's really stopping you from driving, from walking, from sitting for a long period of time. If you can do this on the hourly basis, it will actually help you out a lot. So we'll do this around 15, 20 reps. Nice and gentle. It should hurt so good. And okay, after 5, now all we're gonna do, we're gonna move down the chain. From there, we're gonna go into the hamstring a little bit, right? So now I'm placing the ball on the hamstring. Again, if you're sitting up and you're leaning forward and you feel the pain shooting down, don't do that. Just make sure you lean back a tad bit. And all you're gonna do is you're gonna roll up and down, just like so. Again, the bed is soft, so it's not gonna give me a good pressure. So if you can do it on the ground, it will be a lot better. Again, same thing, 15 to 20 reps. Up and down. And as you guys are doing this, really try to pay attention to your symptom. It should get better. It should keep moving up towards the buttock and not moving down towards your foot. And when we're done with that, we're gonna keep working down the chain. So now we're gonna get into the calves, okay? Again, because the nerve can travel down and split down into the calves, we wanna make sure we're getting the calves as well. So same thing, 15 to 20 reps here. And you can kind of fish around like right there. That's a good tender spot for me. So I'm gonna hang here for a little bit. Should feel nice and gentle, should actually feel good. All right, so when we're done with this, we're already loosening up all the soft tissue up and down the chain when it comes to the leg. Then the next thing I'm gonna teach you guys is how to stretch those soft tissue, because the way the muscle works is that if you get really tight, it's gonna bundle up. With all the foam rolling exercise I give you, we wanna loosen this up, and now we're actually gonna stretch the muscle so you actually have more room to move. It's almost like if the highway is closing down one way, we actually wanna open up so that both lanes can move at the same time. All right, so the first stretch I'm gonna give you guys is a piriformis stretch. Very nice. You're gonna lay flat. You're gonna bring that leg that we just roll out, bring that knee towards your chest, right? The leg is like kind of an burn, so we don't stretch the nerve even more. Pull that knee closer here. And then you're gonna pull it across to the opposite shoulder, like so. From there, I'm gonna hold on for like 30 seconds. So you should feel a stretch right in this area, right? That's where the main complaints is that I have. We're gonna hold that there. for 30 seconds. As you're doing this, it should feel good. It should not make the pain worse. And that's the one thing I want you guys to really pay attention to. So you're gonna hold. As you're holding on to this, I want to make sure you guys are breathing, right? Make sure you're breathing in into your belly, because that's what's gonna do. It's gonna decrease the nervous system stress, right? Because you're in pain, your body's heightened. It's almost like you're sitting in traffic jam. We want to make sure you actually feel nice and relaxed. So we'll hold and then relax. And then we're gonna do it again 2 more times. Again, I try to stretch a little bit more. I pull this. You should feel a nice stretch over here. Again, you're pulling it up in diagonal. And we're gonna hold here, focus on breathing, stay nice and relaxed as much as you can. And I try to pull more. Perfect. And then again, we'll do one more time. We're gonna pull towards your chest and then across to the opposite shoulder. We'll hold it on for another 15 seconds. Again, we wanna go 3 sets of 30 seconds here. Nice passive stretch, focus on breathing, and good. So if you guys are having success with this stretch and you actually have one more, you cross this leg over like so. We're gonna move your hands through here, your hands through here, interlock your finger, and you're gonna pull this towards your chest, right? So this one is a more aggressive stretch. If you can't tolerate the first stretch, this one's gonna be hard. If you can tolerate it, it actually make you feel good, then I would add this in for 30 seconds 3 times. And we're gonna hold that there for 30 seconds. Again, you wanna do this on both sides when you guys are stretching it. And we're gonna relax. And we'll do it again. Interlock, grab, pull. Nice and gentle. It should feel good when you stretch, okay? It shouldn't make you feel worse. Again, the stretch should be around this area as I'm doing this. Awesome. So that's the first 2 stretches I'm giving you guys. All right, so let's for the next one. If you guys have bulging disc, that disc can actually pop out, compress the nerve. So what we're trying to do, we're gonna do some prone press up progression that's actually help put the disc back in place so it doesn't irritate the nerve itself. So all we're gonna do, we're gonna lay flat here. And as I'm laying flat here, all I'm gonna do, I'm gonna try to relax my hips as much as possible. I'm gonna put my hands right here. All we're gonna do to test this out is we're just gonna slowly press up by pushing your elbows into the table to just come up into this cobra pose, just a tad bit. And we're gonna come back down, all the way flat, come back up, right? This is called repeat extension. So we're gonna do this for 20 reps. And you're trying to relax your hips and keep that belly button down to the table. Again, the symptoms should get better as you're doing this. It should not get worse. And you have stenosis. This might not be the best exercise for you. Again, this is for bulging disc. And we'll do 10 more here, okay? And as I'm doing this, if I can get more range of motion and I'm feeling better, I might even play around of pressing through the palm of my hand to try to get more, but make sure I really relax my back here. So we're progressing to a full cobra pose as we're doing this. Here we go. Notice I try to go up higher and higher. We'll go 5 more here. Again, we'll go 20 reps of repeat extensions. All right, so the next one we're gonna do is the nerve glide. Again, where we take care of the soft tissue stuff from the foam rolling. We're actually lengthen the tissue by doing the stretching, and now we're gonna do the nerve glide. That's actually gonna decongest the nerve root itself, right? So you're gonna bring here, same thing, you're gonna interlock your finger, you're gonna pull this up towards your chest, and you're gonna gently think about reaching your leg up towards the ceiling. You wanna feel a stretch in your hamstring when you're doing this. You don't want the pain to keep shooting down your legs, right? You wanna hold that there, feel a nice tension. Hold it for a little bit, and we're gonna do this. Do it 5-second hold, come back down, go back up, 5-second hold, come back down. We're gonna do this 10 times. There you go. Again, the symptoms should not get worse as you're doing this. And then come back down, and then again. So we're on our 3rd one here. So the goal of this is to localize the pain. So if your pain stops shooting down your legs and actually stay around your buttocks area, that means you're doing a good job. Hold that there, come back down, hold there, down. And now what you're gonna do is just do a little ankle pump. So you're gonna bring your toes towards your nose and then straighten out. There you go. So now we're flossing the nerve all the way up and down the leg here. We're gonna do 30 of these. There you go. Again, symptoms should not be worse as you're doing this. Great. I hope you guys enjoyed that video. I hope you feel a lot better after watching this. And again, as a reminder, if the pain is actually not going towards the central, which is getting up towards your back, then you're probably doing it wrong, or it's not the best exercise for you. So make sure the pain is not traveling down your leg when you're doing this. If you guys like this video, check out the other 2 videos I have over here. The first one's gonna be core exercise you can do to strengthen your core to make sure this doesn't happen again. The second exercise should actually help lengthen your hamstring so that you can actually do some toe touching. And if you like this video, please like, subscribe, and I'll see you next time.